Okay, we're treating this as a special public service announcement because we need to talk about something pretty serious, the hidden dangers of using AI for health advice. A new study just dropped, and honestly, if you've ever found yourself typing symptoms into a chatbot, you really need to hear this.
So think about it. It's late, you're not feeling great, and getting a doctor's appointment feels like it's weeks away. That little chat window, it's just so tempting to get a quick answer, right? But here's the big question. Is it a smart shortcut, or are you actually gambling with your health? Well, a new study gives us a very clear and, frankly, a very scary answer.
And you know, this isn't just something a few tech-savvy people are doing. We're talking about more than 40 million people who are already using tools like ChatGPT for their health questions. I mean, just let that sink in. That is a huge number of people, putting their trust and maybe even their health into the hands of an AI. So let's call it what it is, the new digital house call. But how reliable is it really? Well, some researchers decided to find out. They put it to the test. And they focused on one of the most critical skills in all of medicine, knowing when something is actually a real emergency.
All right, this is where it gets serious. We're talking about a major study from the journal Nature Medicine, and that's a big deal in the science world. What they did was they specifically tested a version of ChatGPT designed for health stuff on its ability to do something called triage. Now, triage is basically just the fancy medical word for figuring out how urgent your situation is. It is like the most fundamental skill in medicine.
And what they found? Wow. It wasn't just a simple mistake or a little glitch. It was a consistent pattern of dangerous misdiagnoses, the kind that could have life or death consequences. Okay, just look at this number, 51.6%. This number it's honestly shocking, and what it stands for is so important. So, what is that number? That's the percentage of actual emergency cases that the AI got dangerously wrong. It under-triaged them. To put it simply, in more than half the times when a human doctor would say, go to the ER now, the chatbot said, maybe see a doctor in a day or two. It told people to delay care when every second mattered. And listen, we're not talking about tricky borderline cases here. These were clear-cut emergencies, things like someone who is about to stop breathing, a patient with diabetic ketoacidosis, which can be fatal if you don't treat it right away. And, maybe most disturbing of all, when it came to suicidal thoughts, the advice it gave was all over the place, just dangerously inconsistent. So you have to be asking, what on earth is going on here? How could an AI make such just catastrophic mistakes? Well, the study dug into its logic, and what they found was bizarre. It was like its common sense was completely backwards. And don't just take my word for it. The lead author of the study, Dr. Ashwin Ramaswamy, he put it perfectly. He said, and I'm quoting here, "It was inverted to clinical risk, and it was kind of backwards. Basically, the AI freaked out about small stuff and totally downplayed the really big, scary, life-threatening things." Okay, just look at this comparison. It shows exactly what he means by backwards. On one side, you've got a simple sore throat. The AI overreacts, says go see a doctor. Okay, but then on the other side, you have someone about to stop breathing, a real 5-alarm emergency. And what does the AI say? The exact same thing. See a doctor in 24-48 hours. It's insane. It gave the same low-urgency advice for a minor inconvenience and a potential tragedy. And here's the part that just blows my mind. This same AI is smart enough to pass medical licensing exams. Yeah, the same tests doctors have to take. So how is that possible? How can something be so brilliant on paper but fail so spectacularly when it comes to actual real-world judgment? Well, an expert from Duke University, Monica Agrawal, really hits the nail on the head. She said there's a huge difference between doing well on a medical exam and actually practicing medicine. And that's it, right? A test is about remembering facts, but being a doctor, that's about judgment. It's about context, it's about understanding risk, and that's something this AI just doesn't have. This really brings us to the core of it, doesn't it? The huge difference between a human doctor and a chatbot. And it also makes you wonder, why are so many of us using these things anyway? And look, there are some pretty good reasons why people are drawn to them. I get it. The AI is there for you 24/7. You can ask it a million questions and it won't get annoyed or rush you. For some people, it's almost like a medical therapist. And if you live far from a doctor or a hospital, getting that instant info can feel like a lifeline. So yeah, the appeal's real. But here's the absolute key difference. At their core, these AI models are designed to please you.
They're built to agree with you. A doctor is trained to help you. And sometimes that means telling you you're wrong or giving you news you really don't want to hear. An AI might just go along with a bad idea you have, while a doctor is there to step in and say, "Whoa, hold on a second."
So, after all of this, what's the big takeaway? What should you actually do? Well, it all boils down to a really clear conclusion. And I'm not exaggerating when I say this could literally save a life.
All right, here are 3 critical rules to live by. Rule number 1, and this is the big one, it is absolutely non-negotiable. Never, ever use an AI for anything that feels urgent or like an emergency. The risk is just way too high. Rule 2, it's fine to use AI to maybe brainstorm questions to ask your actual doctor. Think of it as a partner, not a replacement. And finally, rule number 3, the most important one, in a real emergency, trust humans, not bots, period. Call for help, go to the hospital, talk to a person.
So we'll leave you with this question to think about. We know an AI can pass a medical exam. It can memorize facts, but can you trust it with your life? After everything we've seen from this study, when it comes to that split-second, high-stakes judgment call, the evidence is crystal clear. The answer, right now, is absolutely not.